All right, so today we're going to be demonstrating how to properly administer medication with respect to our patients and ensuring that we are administering the medication properly and ensuring that we're documenting what we're doing properly as well in the scenario. So, what we're going to do first is in the scene, I would have already donned my BSI, so body substance isolation put on. I have the necessary equipment with me already. I have a stethoscope and a blood pressure cuff that's off camera right now in order to take our patient's blood pressure. And the scenario we'll be given in this case is that our patient is experiencing chief complaint of chest pain. They have prescribed nitroglycerin, and we have obtained that information from the patient. I don't have any oxygen equipment with me at present time, but in the case that this was a chest pain complaint, I would have potentially administered some oxygen at this point to our patient to help them breathe a little bit more easily if they were experiencing any shortness of breath or anything of that nature. And then let's go into the actual administration of the medication here. So again, we have our BSI on, the proper equipment, the appropriate interventions have been done. We've started to get a history from our patient. If they had already taken in this case, we're going to just demonstrate with a lifesaver candy here. This is going to act as our nitroglycerin tablet. If they had already taken one of these and they hadn't done it in the correct fashion, in this case, which would be in this case sublingual administration, so underneath the tongue, they would put it under their tongue and let it dissolve. If our patient here, Grogu, who appears to be a child but is actually 50 years old in the Star Wars universe, so we will be treating Grogu here as an adult patient. If Grogu's physician had prescribed him nitroglycerin, this being a 50-year-old person again, then we would look at the medication. I would want to read aloud to my partner what the medication is, vocalizing that, communicating with my partner what that medication is so that we both know for documentation purposes. I'm vocalizing it, so I'm hearing myself say that this is the right medication to administer for our patient here, and it belongs to that patient. So we are going to do the initial and primary assessments as we're kind of going along here, and we've already done those at this point. So now we're getting to the point where we're getting ready to administer that medication. So again, and I'm explaining to Grogu here, and I would want to be, of course, down at my patient's level to show respect to that patient. So I'm not standing above that patient talking to them. I would want to say, sir, I understand that you have taken a tablet of nitroglycerin previously from your doctor. I'd want to read again. Grogu was prescribed nitroglycerin by X doctor, and I want to ensure that my partner hears that, and also then getting the correct information from Grogu, our patient here. And by repeating these things over and over, I'm actively listening to what Grogu is saying as well. So I'm showing respect to him as my patient, ensuring that he and I are having a conversation, that I'm taking in the information he's giving me and also then giving it to my partner for documentation purposes. And so once we've determined that the medication is the right medication for him, it's his medication, and he had already taken a tablet. If he had taken it the incorrect way, which could be potentially chewing it and swallowing it in some cases, if he had panicked, perhaps, if he had started to feel poorly and started to panic, and he had chewed it and swallowed it instead of taking it sublingually and letting it dissolve rapidly underneath his tongue so that it could get into the bloodstream from the blood vessels underneath his tongue, then I would want to just explain to him. I want to be educational here, but I also want to do this in a fashion that's relatively fast. I wouldn't be explaining things as long-windedly as I am in this video. I would want to ensure that I'm talking directly to Grogu, again, at his height, and then I would want to begin the process of ensuring we can administer more nitroglycerin if the chest pain for Grogu hadn't subsided. So I would want to ask, again, when was that last time you've taken it? We've got the story now. He had taken it orally earlier, chewed it up and swallowed it. Hadn't affected his chest pain at all. It's still the same 9 out of 10 pain that Grogu's experiencing. So now I want to say, okay, have you taken any Viagra today, sir? Have you taken anything that for erectile dysfunction medication, if it was a non brand name erectile dysfunction medication as well? So I want to then ask that of Grogu, and then I want to then proceed to ensure that I am giving the the proper I'm giving the proper credence to that information. If Grogu had taken Viagra or another erectile dysfunction medication, that would be a contraindication to the administering more nitroglycerin for the chest pain. And then I also need to take a blood pressure. So I would want to explain to Grogu why I'm taking the blood pressure. I need to take the blood pressure in order to give you more. Obviously, this is a much too large of a cuff for Grogu, for a blood pressure cuff, and could give me a false reading in this case. But I would obviously have the proper size. Blood pressure cuff covers 2/3 of the arm, and be able to properly place that so I get the accurate reading. But in this case, this is all I have. So I put it on Grogu's arm. I find that brachial pulse. On the arm, and then I would take a blood pressure with the cuff applied, having found the brachial pulse, listening for that, for the pressurizing until I don't hear anything, and then depressurizing until I hear a pulse, and then until I don't hear a pulse again. So that initial pulse would give me the systolic pressure, the latter pulse disappearing, the latter pressure that the pulse disappears at is the diastolic pressure, excuse me. So once I've achieved the proper blood pressure and shown that that pressure is over 100 systolic pressure, then I would want to give Grogu the 6 rights of the patient. So I want to make sure that it is the right medication, so nitroglycerin, again, our lifesaver tablet, the right medication. We have the right patient in this case. So Grogu is our patient in this case. So we have the right medication for the right patient. So it's Grogu's nitroglycerin medication. We have the right dosage, which is 1 tablet. We have, and before I go into the and we're going to administer this through the right route, which would be orally. Before I go into the time and the documentation aspects of those 6 rights, I would want to ensure that I call medical control. So I would pick up the radio, call medical control, ask for permission to administer a dose of nitroglycerin that was prescribed to my patient Grogu, who is a 50-year-old male who's experiencing chest pain. Chest pain's at a 9 out of 10, systolic pressure's over 100, had taken no Viagra or any erectile dysfunction medication today, have a systolic pulse above 100, and we are cleared to give that by medical direction, give it 1 tablet. Then I would administer the tablet, and I would say, sir, I'm going to give you this tablet. What I would like you to do is lift your tongue up, place it underneath your tongue, and let the tablet dissolve. And let it dissolve completely, and do not try to chew and or swallow it until it is completely dissolved. That way we get that rapid relief that from the vasodilator itself. So again, this is going to dilate the arteries, relax the veins, alleviate tension around the heart, and be able to hopefully alleviate some of Grogu's chest pain. And we would definitely want to transport Grogu in this case, so I would want to get permission for this patient to transport, and I would want to tell them that we're going to get them to the hospital for further evaluation. I want to properly counsel them on the potential impacts that this cardiac pain could be something more severe, like a myocardial infarction or another cardiac event. And so I want to ensure that I've counseled them properly after administering the medication. Then I want to document, okay, I administered medication at this time, check the time on my watch, say I administered the medication if it was right now at 11:58 a.m. We've administered that medication. Then we're going to document that medication. I want to document the route of administration. I want to document the time. I want to document who the medication's for, the dose given, 1 tablet of nitroglycerin. I want to write down the proper medication information, the route given, the type of medication, the time it was given, who the patient is, age, chief complaint, and things of that nature within my documentation for proper pharmacology documentation of this medicine administration. So once that is done, I will then begin the transport of my patient, again, having explained to them what's going on, what the medication will do, and then I will go and be able to then reassess that patient every 5 minutes to ensure that they are properly
taken care of. And we're assuring that that reassessment occurs every 5 minutes, also because that this is a high priority transport, and we are with a patient that is experiencing cardiac pain. So we want to ensure that especially after administering nitroglycerin, that we're monitoring his vital signs, that we're making sure that he's still doing okay en route to the hospital in case we need to provide more interventions, as well as any life-saving care in the case that he is having a heart attack that could become worse over time. So again, that's how we would go from donning BSI, entering the scene, communicating with our patient, ensuring that we have the proper documentation, proper 6 rights read to our patient, and ensuring that we are able to administer the medication in the first place. And that's how we would go about that. And then subsequently, how we would go about transporting, then reassessing our patient and explaining to them what our medication is doing for them. In this case, the nitroglycerin lifesaver candy here, that's acting as nitroglycerin, what that is doing to them as well, and then going into that reassessment. So that's in total how we would perform the skill. Thank you very much.